Treating opioid addiction with opioid drugs? Okay, I'll admit it sounds like it doesn't make sense, but consider this. Suppose there's medication that help people recover from opioid abuse, manage their withdrawal symptoms, avoid overdosing, be able to participate fully in their recovery, and keep them away from more dangerous opioids like heroin and fentanyl. It's called Suboxone, and it's an opioid that helps countless people free themselves from opioid abuse. What is Suboxone? Suboxone is the brand name for a medication consisting of two separate drugs. One of them is buprenorphine, an opioid painkiller. It's part of the same family of drugs as codeine, heroin, morphine, and even fentanyl. Now, the other drug is naloxone. Naloxone is what's called an opioid antagonist, which means it blocks the effects of other opioid drugs. How does Suboxone work? Suboxone works similarly to other opioid drugs. It binds to certain areas on our nerve cells, which changes the way we perceive pain. Like other opioids, Suboxone also produces euphoric effects, although they're far less intense than other opioids. Withdrawing from opioids is so unpleasant, it's often a massive obstacle for people seeking treatment for opioid addiction. I've met many people who desperately want to get off drugs like heroin and fentanyl, but were afraid of going through withdrawals. Suboxone makes that part of recovery easier to bear. Also, Suboxone is simply safer. It's administered in a safe environment, so there's no risk of being robbed or assaulted. You can't get bloodborne diseases like hepatitis or HIV when using Suboxone clinically. And finally, when given out clinically, there's no risk of being exposed to fentanyl. How successful is Suboxone? According to the National Institute of Drug and Abuse, or NIDA, a study showed that people on buprenorphine were nearly twice as likely to stay in treatment as patients not on buprenorphine. There's no such thing as a miracle drug. While Suboxone is certainly beneficial, it's not enough on its own. Suboxone is best used when combined with a comprehensive drug treatment program. Thanks for watching our video about Suboxone. Our YouTube channel is a great source for fact-driven content about addiction and more. Reach out to the Edge Treatment Center today at 844-590-0403.